Hey, everybody. How you doing? I am Dr. Josh Satterlee. Hey, I wanted to cover this webinar. A couple people were asking about it. And this is three keys to a more accurate patient history. This is so vitally important because communication with patients is paramount. And really what we're trying to do at Trust-Driven Care is look at the research, see what does the research say about how to improve communication, and then find technology and tools that will help us do that more often, consistently, better, and do it every single time, right? So this is all about a more accurate patient history, which is so important because that's where people often get false negatives. And we always say false negatives are the things that kill people because you tell people they don't have a disease when in fact they do. False positives are the things that drive your billing department nuts because you do an extra test or an extra service when really it wasn't needed. But listen, we're going to screw up one of them. We should definitely make sure that we're getting our false negatives covered. So, three keys to a more accurate patient history. Let's jump in. Why is this a big deal? And what is the problem at the initial exam that we really need to cover? According to research, most patients have an overwhelming amount of patient anxiety. In fact, 30%, it's estimated that 30% of patients don't pursue medical care simply because they're worried about what we'll find. 30% of people don't go to the dentist because they're worried that they have cavities. 30% of people don't go to cardiologist. Why? Because they think that the cardiologist will confirm they have a problem. 30% of people are not getting care because of anxiety about what's going on. What about everybody else? Well, if 30% have so much anxiety that they're not even showing up, we can assume that a large part of the people that are showing up have a lot of anxiety as well. Not enough to prevent them from coming in, but in fact, a lot that prevents them from being totally honest with you as a provider. Maybe it prevents them from answering questions honestly. And the problem that develops is we as providers take the patient history to be 100% accurate, when in fact, research currently says it's maybe 50% accurate. How do we change that? How do we guarantee accurate information? One of the other problems is patients are very nervous to ask questions, much more than you think. Again, looking at the research, so many patients are nervous to ask the doctor a question. Some of this is cultural. Some patients believe that the doctor is never wrong and therefore should be held at a very high standard and don't question them ever. Sometimes there's language barriers, there's cultural barriers, there could be age barriers, an older doctor with a young patient or vice versa. There are many, many barriers that may limit patients from feeling like they can ask questions. The core issue there is that questions often lead to the best discussions that reveal the true diagnosis that's going on. Only when people ask, is it a big deal if my right foot is numb? Or is it a big deal if I can't control my bowel or bladder function? Is it a big deal I pee my pants when I exercise? Those kind of questions we obviously want to open up to as providers. But on the same regard, if we don't pave the way for those questions, they often won't happen. The initial exam or initial history will be cut short with just yes or no questions, and we won't really have a true picture of what's going on. So patients are often worried to ask questions. Also, in the research, it often happens that providers lack empathy. Now, I don't think that there's any provider out there that wants to lack empathy. I think when the research says this, what we're dealing with is all of this care and all these histories are being done by human beings that have their own concerns, human beings who might be feeling a little sick or worn down or tired at the end of the day, and they're not displaying the empathy that gets that patient to open up. What if a patient found out that their child is sick or that someone in their family died recently? We can't ensure that they'll ask the right questions or that they'll display that empathy that gets patients to open up. How do you combat that? We'll talk about it in this webinar, but the easiest way is send messages that are automated that guarantee you don't need to be a hero that day. If the messaging and the content of that message is correct, you can ask it on your worst day and still appear as if you have empathy. Another subject brought up in a lot of the research about initial exams is providers lack humility. Even when they don't necessarily think they're being egotistical, patients perceive them to be that way. In fact, there's a study that I love that talks about the patient satisfaction leaving the initial visit. The providers, when rating themselves to an independent third party who also got to see the visit, providers often rank themselves about 80% effective, 87% effective, B plus, A minus. They'll say, oh yeah, I have a little bit to work on, but it went pretty good. So providers grade themselves 87% effective. If you ask the same patients that they just got done talking to at the same visit on the same day, those patients will rank them about 60% effective. So a full third difference that the doctors think they're doing a great job and the patients are thinking they're doing an okay or even a poor job of asking the right questions and following through. Why is that? Well, the provider is the smartest person in the room, essentially, right? They've spent a lot of time studying and learning for that moment. And in such, they understand the problem that they're being faced with or the patient is facing much better than the patient themselves do. But it's the patient's first time. You may have seen 1,000 patients in your career, 5,000 patients, 10,000 patients in your career. But to that patient sitting in front of you, this may be their very first visit about this condition. We need to be humble to get them to open up. And humility leads to empathy and trust. And that's really what we're all about. Another issue that's brought up often in the research is that the physical healthscape can be challenging. If you do an initial evaluation where you sit across the table from your patients, they're not going to be as honest, and they will have more of that anxiety. However, if you can just change things very simply by sitting next to your patient or sitting in an L formation, two ends of the L, they seem to open up better. But that physical healthscape may be challenging, especially if you're not the one who has the control over how to set up that office. So it's worth addressing, but moving chairs around and sitting across from your patient can help quite a bit, or sitting like kitty corner from your patient can help quite a bit. Finally, there's often language barriers and belief barriers. Some patients don't believe that doctors can help, or they believe that they have bad spirits that are causing them to be ill. I've talked to a chiropractor who says that they work with a lot of Hispanic patients, and then there's I don't remember how it is, but there's a spiritual demon essentially that can cause low back pain, and perhaps they feel like they believe that, but when they share that with the doctor often scoffs or laughs at it, creating more and more barriers. Even though they may have a different perspective, we need to honor that and validate them and not laugh or scoff at them. It's made even worse when there are language barriers, because now the questions we may not get the right answer to, or asking somebody who speaks Spanish, porque versus porque, may get you two different answers, even though in English those translate to nearly the same thing. For what reason, right? So it's important to overcome those language barriers. Again, that's easy to do with technology, because you can set technology up to be delivered in the language of the patient. That's what the problem is. As we go back, we notice that the research has quite a bit of information regarding communication and how it leads to patient adherence and treatment. That's a big deal. You want your patients coming back more often. And it turns out that when your patients come back more often, they get better faster. A good way to get bad results is don't have people come back. There's also the studies of using mobile apps and text messaging. That seems to be a very positive thing. There is not a positive relationship with email messaging, by the way. And then finally, if we look at best practices, we get to those behaviors: opening up for questions, communicating before the visit, making sure we validate the patient and their feelings and their beliefs, and yet still work together to find a solution. So the research is clear. It's important to communicate via text message before the initial exam. Why do I say communicate via text? Again, there is no research saying that email leads to positive outcomes. Text, there's quite a bit of research saying that text messaging leads to better outcomes. It's in every research project that I looked at, every one of them, SMS messaging is a positive outcome, or creates positive outcomes around many things: lower pain scores, higher adherence, better understanding, less annoying phone calls, or less overscheduling by concerned parents. Text does well, email does not. Why is that? I think at its very core, the issue is text messages get delivered at 95% and get about 93% of messages that are delivered get read. Whereas if we look at email, it falls down to 20% at best. Sometimes it's 15 to 20% get opened, even fewer than that. get read, and even fewer than that get replied to. Text message cuts through the clutter if you use it right, and it's actually communication. Also, two-way text messaging is great to encourage questions. Sending your patient a message before their first visit saying, "Hey, we look forward to seeing you, and be sure to bring any questions you have with me." A simple line like that, "Be sure to bring any questions you have," opens up that communication strategy so they can ask questions. Now, one of the things that's important there is if you're going to encourage questions, you have to then also encourage that the method you're using works. For example, two-way text messaging, they can reply and ask the question right then, or they can respond and say, "I will be sure to bring them." This doesn't work if you're using one-way text messaging. One-way text messaging, like a lot of EMRs offer, doesn't allow for that response. And in fact, when the patient responds, they typically get a message saying, "This isn't monitored," which tells them don't ask questions, right? It shuts down that line of communication and everybody loses. So it's important to encourage questions and at the same time, allow for a pathway that has questions as well. And that means two-way text messaging. Third, to overcome those barriers to anxiety and those barriers of language, using pictures seems to be a much better method than just words. For example, send a map link. A map link will work in many languages. Send a picture of your office. The picture, as they say, is worth 1,000 words. And it doesn't even have to be there doesn't have to be an accompanying language component of it. Just circling the door to your office or drawing an arrow on that, it spans all languages. So using those pictures as often as possible seems to create some better outcomes. You can also send pictures of the condition or images that you think help those patients understand their condition. And that seems to break down those barriers, reduce anxiety, and lead to more accurate histories, which is what this is all about, right? So how do you do it? 3 recommendations from the research. What are some action steps? Number 1, you've got to be doing two-way text messaging. You have to. There's no choice anymore. I think this is like moving to a paperless office. It's just what is required now. And think about it. How do you communicate with 99% of the people who matter in your life, right? Do you send a lot of emails to your family, or instead are you sending text messages? And that's what's really important. So two-way text message is just how most people communicate now. So honor that as a provider. So 3 recommendations: send a message 24 and 48 hours prior. Why do I say 24 and? I used to say 24 to 48 hours, but I use and now because if you have the time, if you're the type of provider that has 1 to 2 days of time before the patient comes in, sending those messages 1 and 2 days before works even better to break down that anxiety, reduce that anxiety, open up that line of questions, and ultimately lead to a more accurate history because the patient will be more honest because they trust you and they know that the rules have been set. Secondly, reduce anxiety with useful pictures, whether it's a condition, whether it's anatomy, whether it's where your office is or where to park. Pictures span languages. So it helps people feel more comfortable. Plus, you can reduce the anxiety by just showing them a picture of, for example, what does your office look like? So when they pull in the parking lot, they know which one it is. Or you could have a picture of who they will meet at the front desk. Or if you have a very large office with 6 or 7 providers, where should they go to when they first walk in the building? Where should they go? Sometimes there's a certain new patient reception area. Sometimes you want them to meet with a certain employee. Whatever it is, send those useful pictures that, again, further that relationship, open it up, and lead to a more accurate history. Third thing, and this is the toughest, is validate the patient's concerns. It's difficult to say, "I believe you," when you think you're possessed by a demon. But that may be too difficult. But instead, we could obviously say, "I believe you that you have some serious low back pain. And we're going to do what we can to find out why that is." Whatever they have, it's important that you pair it back to them that exact language they used. If they say, "I have burning," say, "I'm sorry," or "I believe you that you have burning in your spine." If they say ants crawling on them, parrot that back in that exact language. It shows them 2 things. Number 1, it validates them that they're not crazy. And the second thing is, it also validates the fact that you are listening if you use the exact language they did. So validating your patient's concerns seem to improve in adherence and improve outcomes and lead to actually more referrals and more word of mouth marketing. Again, everybody wins here and they feel heard. So important. But as a warning, I just want to make sure, once again, email is not effective. It just doesn't have the same research backing it like two-way text messaging does. Two-way text messaging is much more effective. Sending yet another email or an email reminding them that they didn't open up the first email is chasing your tail. I would encourage you, don't send an email reminding people to open up another email that they haven't opened. It's just piling more stuff on them and they're not going to do any of it. Secondly, please don't make the mistake of sending one-way text messages or using your EHR or system that says, yeah, we send out messages on your behalf. They're often from another phone number, another area code, further reducing trust with patients. And if the patient responds and gets a message back saying this number is not monitored or you can't text back, it starts to put up psychological barriers to them getting the care they need and them being honest in their initial evaluation, both of which we want to prevent. Third thing, construct your messages, if you are going to text, just like you would message a friend. Oftentimes, offices start using two-way text messaging, but they send these long, robotic-sounding messages. This is to confirm that Sharon Smith has an appointment on, and then the date format is written in some international format that computers use, and it says at location : Shadow Lane. Like, that's not how you would text your friend. So saying things like, hey, we will see you tomorrow at our Shadow Lane location at 10:45. That works way better and, again, reduces anxiety and gets people to open up with honesty at their initial exam. So be careful of those pitfalls that seem to make your life easier. Like, it is definitely easier to use one-way text messages sent out by your EHR, but does that really get you the effect you want? I mean, it's easier not even to waste time on diagnosis. Let's just get right to treatment, because that's really what people pay for. But in fact, we need to take that step and make sure we communicate well. We need to take that step and make sure we diagnose well. So the results, patients open up after you knock down those barriers. They open up about the real issue. And you will be surprised with the research says about 12% of your patients will reveal red flags and or yellow flags where otherwise they didn't, simply based on opening up and having that ability to ask questions. One other thing is you don't want patients to accidentally agree to a yes or no question when in fact they do not have that attribute. So if you ask them, do you ever have numbness? You don't have any numbness and tingling, right? And they say, no. The problem is that we just created a false negative. Also, patients end up asking questions, and those questions, according to the research, are often the pathways to the true diagnosis. When they ask about lack of control of their bladder or numbness, tingling, or burning pain, that often opens up a pathway to find out the real diagnosis. And finally, you end up with higher treatment plan adherence. Oftentimes people think, hey, my treatment plan called for 20 visits. They only came in for 12. How do I get them from 12 to 20? The problem is not there. Swim upstream and see, did you establish a trusting relationship at the initial exam? And you will find the solution to your problem. So again, 3 recommendations: send messages 24, 48 hours and 48 hours prior, reduce anxiety with useful pictures, and validate the patient's concern in that office. And just so you know, we're doing this because this is some of the aspects, some of the features we offer with TrustDrivenCare. It includes two-way text messaging templates, so you can write your message one time and make sure it encourages questions, and allows you to write those and send them out automated. When people have an appointment, they'll automatically get the 24-hour and the 48-hour message. You set it up once, and no matter what, it runs. You don't have to be Captain Empathy. You can allow these messages to work for you. Besides that, it offers many more communication features, things like a missed call text back and a little web chat widget on your website. If you're interested, check out TrustDrivenCare.com. I would love to give you a demo of it to show you how you can communicate better with your patients. With that, I'll let you get back to whatever you're doing this evening, but I appreciate you paying attention, and we will see you on the next webinar. Thanks so much.